one of the things that happens is if you receive an event notification from the state and an event notification from Care Everywhere, it's one of those things like whichever comes first, right? ADTs are primarily what we're receiving from ENS, and then Care Everywhere, if the organization has opted to turn on the functionality, will receive the notification, but will also receive it with a CCD document. So for the clinician's point of view, they're going to receive the two notifications, right? But in our Happy Together functionality, right, that's where we have a meld of internal and external data, and that allows the deduplication logic happens there, where it's going to say you have two notifications coming from the same source. So to the clinician, they're just going to see one view. So currently, when we receive the notifications, whether from the state or other Epic organizations, it files into the clinician's in-basket workflow. So we have several in-basket workflows within Epic. One is if a provider is listed as a care team provider and they receive the event notification from the state or other Epic organizations, they will get that notification directly in their in-basket within Epic. The second piece of it is if the patients meet a certain criteria that we have defined by a custom rule within Epic, that will also route to the PCP, but in addition, it will also route to our case managers and our transition to care managers. And that's using an Epic in-basket pool. So it evaluates the rule, and it says, okay, if the patient meets this criteria, we're going to send it to the case managers, and they can actively work that in-basket and do their outreach from there. As far as our community providers, Epic has a functionality called Epic Care Link, and it's a web-based portal for those clinicians who don't use Epic as their primary EMR. And again, if they're listed as a care team provider within Epic and a patient of theirs has gone outside of Memorial, they will also receive that notification within their web-based portal as well. So initially when we went live with ENS, after we went live with our panel, we were receiving notifications from the state for events that happened within Memorial. So I had to work with the AI team quickly to prevent that from happening, because we already have that notification within Epic already. So that was like a lesson learned. So the internal notifications that occur within Memorial, that lives in one in-basket folder called a hospital ADT folder. All right, and again, if you're the PCP and you're set up to receive notifications, you'll receive the Memorial inpatient admissions, ED admissions within that hospital ADT folder. If you have a event notification that's coming from another Epic organization, our clinicians will view that in what's called the outside events folder. And then for the state HIE, we created a custom folder called the Florida HIE event notification folder, so they know to differentiate where the notifications were coming from. Our initial approach was to create one folder and have it all file into one folder. But after talking to our clinicians, they felt that having it separated out would be better. At least they can delineate which one's within Memorial, which one's coming from the state. At least they know they're going to get, that set data element from the ADT information. And with Epic, they'll be able to get more from the CCD. So they use that as their delineation between what messages are where it's coming from. So our primary stakeholders are our care management team, our transition to care management team, and our clinicians, our PCPs. And the response since we've gone live has been really good. In addition to what the state is giving us with ENS and the mix of Epic event notifications, I mean, they've been able to mobilize their operational workflows based off of the notifications. Before they were working off an Excel spreadsheet, or it was more manual. Now it's more real time. It's a work queue. They can act on these messages real time, and hopefully, prevent a readmission or prevent an admission to the hospital. So if your EMR has the technical capabilities to do similar, like what we're doing within Epic, the biggest part of it is for me, I think, is early on developing your roster, right? What's going to give you and your organizations the most bang for your buck, right? Based on how you're stratifying your patients. So you may want to stratify them by high cost, high ED utilization, high risk patients, as your initial subset of patients. But in addition to the roster, you also want to make sure that the system and the integration that they're going to give you is going to be able to help streamline your operational workflow. So one of the things that we gain from purchasing this interface for the Florida HIE event notifications is the ability to have that ADT information come in, have it file into an external data repository, and then also make it visible within the patient's chart for the clinicians to see. We also, the added benefit to it, in addition to that, is we have the ED readmission risk scores, inpatient risk scores within Epic, and the information that we receive from the state is also fed into that as well. So you're truly getting a good picture of what the patient's risk score is for potential ED readmission.